Many patients are confused about the role of genetics and biomarker testing in prostate cancer care. For people who haven't heard of some of these terms before, let's go into the definition. So, what is genomic or biomarker testing, first of all?
Well, so I think there's one thing. Maybe I can explain because the wording can be confusing. So there is the genetics and there is the genomics. And one of them is the genetics would be what we inherit from our families. So this would be present in our body. The genomics testing would be to look for what the structure of the genes of the cancer cells itself. Now, that doesn't mean that this was inherited. It's just that this is a renegade and it evolved, and that is what is going to show up. The reason these two are important, both of them have implications potentially for treatment or perhaps clinical trials. And again, with the PARP inhibitors, the BRCA-like genes will have implications for treatment, sort of for resistant cancers. With regard to the genetics, the implications are for, again, inheritance of family and potential risk for blood relatives. Now, there are panels that are FDA approved for the purpose of genetic testing, and the requirements or the indications right now, anybody who presents with metastatic disease or an aggressive disease at diagnosis, the recommendation is to proceed with the genetic testing, certainly counseling and testing, because there are some people who prefer not to be tested, and that's something else. What I tell my patients is this: even if the testing is done and it was negative for inherited genes that might put the patient family at potential higher risk, the fact that a person has prostate cancer by default puts potential adds risks to family, to blood relatives. And the risks aren't just for the males with regard to prostate cancer, but certainly breast cancer, ovarian cancer, pancreatic cancer potentially, and things of that sort. So this is where I think a patient needs to be discussing with their doctors. And certainly there are many centers that have genetics counselor. And so that's where I generally refer my patients to. I counsel them myself and then refer them also for more discussions with the genetics counselor.
What exactly are genetic mutations and how do they impact a treatment path?
Well, I think, again, is the changes that happens in specific genes that may promote the aggressiveness of the cancer. And so the BRCA gene is one of the oldest genes that have been identified in breast cancer. And essentially, the body regulates itself. And when the cancer cells come up and they the body no longer sustains that kind of regulation, the genetic regulation in those cancer cells will behave the way they want to. And so, that means that they're going to grow faster. That means they could be resistant to treatments and things like that. And so that's where we check for these alterations. And there are certain medications that would allow, and again, in prostate cancer, it's not a lot. It's just, as I said, right now, the only things that are proven is the PARP inhibitors. This is essentially to kind of gang over the cancer cell, prevent it from allowing it to repair itself so it can continue to grow.
Some patients may not know if they've received these important tests. So for patients who aren't all that sure, what key questions should they be asking their physician or their specialist?
So I would say when it comes to the genetics testing, I believe a patient has to consent. So if it has happened, because again, we live in the US and this is a private matter for the patient. So this generally has to be the case. For otherwise, depending on the institution, sometimes some tests will require for the overall testing, looking for any genetic alterations, general tumor alterations. Different centers have different things, but the patient should ask and say to their doctor, have my cancer genes being tested? Have my genes being tested? And if they have, what are the results? Because we generally share it with the patients once it's been done. The other thing I should point out, some of the good things that have happened recently, up until recently, when it comes to the tumor genomic testing, tissue was required. Nowadays, the FDA has approved blood tests that several companies now run that can actually collect blood sample and basically test it for circulating tumor cell genes there. Now, no testing is 100% perfect, but in situations like patients with prostate cancer who may not have recent tissue or adequate tissue for testing, certainly doing the blood test to verify if there is anything that is reflective of the genes of the cancer, and that may allow for potential, actionable type treatments. Again, up until now, this is more going to apply for potential clinical trials or resistant metastatic disease.